And this week on Houston Newsmakers, what's the mess that is healthcare in America? The president and CEO of the Episcopal Health Foundation has experience in working to make healthcare work better. We'll talk with her about what might work and what her foundation is doing to help. And the Alley Theater isn't just about performing. You'll see the amazing impact it's having on the education of thousands of children in the Houston region through its staging STEM program. The arts integrated into the teaching concepts in science. And the efforts in Houston to increase opportunities for small business owners, what you can do to enhance your chances for success. This morning on Houston Newsmakers.
From KPRC Channel 2, this is Houston Newsmakers with Cambrell Marshall.
Who can you believe? About health care. Has the Affordable Care Act been as disastrous as Republicans say it's been? And how good will the GOP plan be if it's passed? With the shoe on the proverbial other foot, with Republicans in control of all houses of Congress, the much-awaited plan was rolled out to very mixed reviews, with the Congressional Budget Office analysis throwing a dash of cold water on some of its enthusiasm. It's easy to be confused. Elena Marks is here to help us sort through some of the challenging topic of health care. Elena is the president and CEO of the Health Foundation, the Episcopal Health Foundation, with faith and hope as its foundation and a belief that all Texans deserve to live a healthy life. She's also a non-resident fellow in policy at the Baker Institute of Public Policy at Rice University. Good morning, Elena. Good to see you.
Good morning.
This whole thing, healthcare, it's kind of messy right now. What does it take as a viewer, as a person who's just watching it all happen? What kind of suggestions can you give to people to try to make some sense of all of it?
Well, it is complicated and it is confusing. The way I've been looking at it is to compare what was put in place by the Affordable Care Act in terms of coverage for people. One of the main purposes of the Affordable Care Act, which some people call Obamacare, was to expand the number of people who could buy affordable insurance coverage. And in order to do that, the federal government provided very generous subsidies for lower and moderate income people so that they were able to afford those plans. That was really expensive. And what we have seen in the American Health Care Act, which is the bill the Republicans in Congress are promoting, is that they have reduced the costs that were associated with the Affordable Care Act, but they are doing so at the expense of what the Congressional Budget Office says is 28 million Americans who will become uninsured as a result of those changes.
And that has become rather political in the way it's being spun. If you take the politics out of it, how bad has the Affordable Care Act been for the American people?
Well, it depends what you look at.
I know.
So for our foundation and for my work at Rice, I focus on access to health and health care for low and moderate income populations. And for those populations, the Affordable Care Act was a godsend in two different ways. First, it made the ability to buy private insurance in the marketplace affordable by providing generous subsidies that were tied to income. So the less you made, the larger your subsidy was, the more you made, the smaller your subsidy was. And so it enabled millions of people across the country to buy insurance when they simply couldn't have bought it before that.
And now the CBO is saying that with the Republican plan coming out, now this is the CBO's numbers, depending on what they say, different parties want to either believe them or not believe them. If you were to have the ear of the people who are making the decisions now about what kind of health care should be in place, what would you tell them that needs to be done to kind of make this thing happen?
I would tell them that health care in this country is very expensive, and that if we want everyone to have access to health care, we've got to acknowledge that it is very expensive, and then we've got to figure out how to do it in the most cost-effective and efficient way. You can't have broad access to any kind of health care service that you want and expect that it's not going to cost a lot of money.
The president has said, when he was talking about and touting the new plan and whatnot, that his plan and the new plan was going to ensure as many or more people for less cost. And is that what I think I heard, or something similar to that?
I think he made those statements during the campaign and since the inauguration, that more people would be covered, they'd have the better set of benefits, and the costs would be lowered. I think what everyone is now acknowledging is that's just not possible. That's an equation that doesn't work. It's math.
Medicaid is a big part of this whole thing, was it not? I mean, that's part of what, when you talked about people who could not afford, a lot of those folks are taking or on Medicaid, and that's part of the process as well, is it not?
In some parts of the country. So Medicaid is a program, a federal state program that originated in the 1960s, and it covers very low income people. And in Texas, Medicaid covers about 4.3 million people. The vast majority of those are poor children. The next largest group within the Medicaid program are elderly and disabled people. There is a myth in the country and in Texas that there are a lot of able-bodied adults who are covered by Medicaid and are given this free insurance. It's simply not true. In Texas, to be on Medicaid, you have to be a poor child, or you have to be a poor pregnant woman, or you have to be a very poor parent of a child, meaning under $4,000 a year in annual income, or you have to be disabled.
Is the new plan that is being proposed there giving, I guess, block grants or something like that, is that going to be good for Texas or not?
That's going to be devastating for Texas. The plan proposed in the American Healthcare Act proposes to change the way Medicaid is funded, the way the federal government supports it. Historically, the federal government has paid a share of the cost of the program. The programs are run by the state. In Texas, and Texas designs its own program within federal constraints, the federal government is paying 56% of the cost, regardless of the number of people who are covered or the way the state structures the program. Under the American Healthcare Act, in order to limit the financial exposure of the federal government, the federal government will have a per capita allotment, is what they're calling it. And so there will be an amount of money per recipient that is awarded by the feds to the state each year without regard to cost. And what that means for a state like Texas, where the demand for Medicaid services continues to increase. We have an aging population that is going to become increasingly disabled and therefore Medicaid eligible. And we have a very large percentage of our children who are poor and who are born to poor women. And so when that population grows and the funding that comes from the federal government shrinks at the same time, the state is going to be faced with some pretty grim choices.
A lot of the conversation is about taking away the government's involvement and giving people more choice. How can that be done in such a way that people won't be hurt?
Well, what a lot of people like about the per capita or block grant approach is that it gives the states more flexibility. And that is true. The states would all like, and I would like to see Texas have more flexibility in its Medicaid program. However, that flexibility comes at the expense of billions of dollars per year. And the question I would pose is whether that trade-off is worth it, and I would say it's not.
In the final seconds we have left, the Episcopal Health Foundation, what role do you play in trying to make sure that people who really need health care will be able to get it?
Well, first we try to educate the public, policymakers, anyone who is paying attention to the issue by publishing accurate, fact-based, nonpartisan, not political data on the topic so that we can inform the conversation. We also work closely with many organizations that are interested in increasing access to care, whether that's by getting people enrolled in insurance or other programs that are available, or by making sure that we have a safety net that is able to provide services where there is no other source of
I want to make sure that people, I'm sorry to cut you off, I want to make sure that people get information about where they can get more information about your organization. It's very easy, episcopalhealth.org.
Correct.
You must have come up with that. It's pretty simple and easy.
Pretty simple.
Number is 713-225-0900. Call that number, get more information. Elena Marks, thank you for being here. I always feel so much smarter after I talk to you.
Thank you for having me. It's a complicated subject.
It is indeed, but you've been able to add to it this morning. Thank you. Up next, you may not believe the way the Alley Theater is impacting education in the region. Let's just say it's not the old-fashioned way of teaching. In fact, far from it. The combination of theater arts with education and the impressive improvements being seen. Next, when Houston Newsmakers continues.